Well, good day, everybody. Thank you for your interest in the Imbed Biosciences product, MicroLyte Vet, which is a very new product. Let me introduce myself. My name is John McAnulty. I'm essentially a co-inventor of the MicroLyte Vet product. This came out of our laboratories at the University of Wisconsin. I'm currently a professor of surgery at the School of Veterinary Medicine at the University of Wisconsin and chairman of the Department of Surgical Sciences there. And for disclosure, I am a co-founder of Imbed Biosciences and continue to work as their veterinary medical director in the development of this product. So my presentation will be just to familiarize you with the MicroLyte Vet product. This is a new wound dressing. It's really a matrix dressing that has a combination of antimicrobial effects and a hydrogel in order to treat difficult wounds. When MicroLyte is placed on a wound, it basically deposits a microscopic multi-layer polymer on the wound that immobilizes the antimicrobial silver nanoparticles. And because it's loaded with this antimicrobial silver, it has really broad spectrum antimicrobial effects, kills virtually everything. And in particular, the MERS, Staph aureus, MERS SP, MERS SS, a lot of these very difficult microbes that we're commonly dealing with on a day-to-day basis now in our clinical practice. The way the MicroLyte is constructed, it is able to get a very antimicrobial effect with relatively low concentrations of silver. So we're able to avoid the toxicity of silver that is seen in other silver-containing products. And so it's safe for the skin, it's safe for the wound surface. Certainly it does no harm. And it can also not only be used on wounds that might be difficult to heal, but you can use it in clean incisions in order to prevent infection. So as a antimicrobial prophylaxis. The material elutes silver ions, which are the active antimicrobial portion of this, for 3 days, and then it dissolves and is removed from the wound bed either by exfoliation into a covering bandage or by macrophages at the wound site. So there's no need to remove any residual matrix of this material. To give you an idea of how the MicroLyte is constructed, there's about 100 to 200 layers of oppositely charged polymers that are laid down on top of each other. And those layers are then doped with silver nanoparticles in situ. So we saturate it with silver, we reduce them to the nanoparticles. And so they're very consistent in size. You can see on the electron micrograph on the left, the small particles are all very similar. And that's different than some other products where they make silver nanoparticles and then add them to a product such as Acticoat. On top of the polymeric layer is essentially a polyvinyl alcohol layer. And this allows the MicroLyte to be thick enough to be handled with your fingers. So it makes it a very practical, convenient clinical product. And also provides a hydrogel as it absorbs fluid from the interstitium of the wound bed. One of the key factors with the MicroLyte technology is that it's ultra thin and it does conform to all the small interstices of the wound bed. And that's a key factor in the activity of the silver because by releasing the silver right at the cell surface, it increases our antimicrobial efficacy tremendously. And that's the reason why we can get the same efficacy as a product like Acticoat, but we can use 100-fold less silver in the product and eliminate the problem with silver cytotoxicity. Other products, the way they get silver down to the wound bed is they essentially put a lot of silver in those dressings, and then they flood the wound with silver, so you have a fairly uncontrolled release of silver, and they run into problems with silver toxicity. These are just some graphs to give you an idea of the efficacy across a wide range of organisms. So we have both Staph aureus, MRSA, we have Pseudomonas organisms, E. coli, Klebsiella, and then Candida. So this also is effective against certain yeasts and fungi. And you can see that, we get 5 to 6.5 log unit reduction in bacteria on those wound beds within a day. Equally important is the fact that it's non-cytotoxic. So these are basically with cultured cells, looking at the survival of those cells. And when we add our MicroLyte to those solutions, we basically get virtually no cytotoxicity. And in fact, we've shown we can grow fibroblasts right on top of the MicroLyte. Whereas other products such as the Aquacel or Sovalon or Acticoat, they have pretty significant cytotoxicity. And that's the reason why in the United States, they're only approved for use on wounds that are already infected. Whereas we have approval from the Food and Drug Administration to treat wounds that are infected, but also wounds that are clean, and use it as a prophylactic protectant for a wound surface. So a few examples of cases that were fairly dramatic in using this product. This is a 2-year-old bulldog that was in our clinic. It had been hit by a car and had a pantarsal arthrodesis. And the wound got infected and burst open. And you can see the bone plate from the arthrodesis was exposed. This was open for 5 weeks in spite of a wide variety of conventional treatments to get that to close. And finally, in the early days of our beta testing of MicroLyte in the clinic, the clinicians, we talked to them and said we think this would be a good exemplar to try our new product. And so we just treated with the MicroLyte right across the wound and over the bone plate. And what you can see, what interested me, was within 1 day, the granulation tissue starts to advance across that bone plate. In 3 days, it's barely visible. By day 11, it's almost completely gone. And by day 13, we just have a small granulation bed that's epithelializing. So some pretty dramatic results for a really problematic wound in that case. In this particular instance, we had a mini poodle that was presented for a nail check. And I think with all the long hair, the owner didn't realize how bad the problem was. And there was really severe necrotic tissue on the right front foot. And so that was debrided away, as you do with normal surgical management. And then MicroLyte was applied to that wound every 3 to 4 days. The wound was cleaned up as needed. And after about 6 weeks of treatment, you can see that that wound has really gone on to epithelialize and is almost completely healed. And later in that season, even there's regrowth of hair, and the scar is basically virtually invisible at that point. Another use that we've seen, and this is happening in veterinary medicine as well as in the human medical arena, is use of MicroLyte in wounds that are prone to getting infected but are not necessarily infected or contaminated at the time of surgery. So Dr. Gibbs at the Animal Hospital in North Carolina has started using this product on every C-section that he does. And also on colic surgeries, reconstructive surgeries, orthopedic surgeries, and other large incisions where the MicroLyte can be placed in the wound, allow it to adhere to that wound bed, and then the wound is closed with the MicroLyte in the wound. The MicroLyte will break down just as it does on a surface wound, and is then eventually transported away from the site by macrophages and eliminated from the system. So there's no need for any removal. So you could think of when would you consider using MicroLyte, and it's whenever there's a potential problem, whether they already have an infection or you have a wound that won't heal that might have a biofilm, or a wound that's just prone to surface contamination or was contaminated during surgery. Use it as a prophylactic. So whenever you think there's a risk of microbial colonization of those wound beds, MicroLyte is a potentially appropriate treatment for all of those wounds.